here. So I'll call upon the next speaker, Dr. Ambarish Darak, for his talk on refractive surgery, a new era of technology. Dr. Ambarish, yes, he is here.
Ambarish has got a dynamic practice of refractive surgery in Pune and also all over Maharashtra. He is one of the leading refractive surgeons. So it will be nice to hear him. Over to you, Ambarish.
Yeah. Good afternoon, everybody. I know it's lunch hour time, but I'll just brief you about my findings about this new laser system. So examer, although we are hearing a lot of stories about lenticule and whatever is happening, whatever innovations are happening in refractive surgeries, but still we know it's a proven technology with us for last 35 years. And most of the time what we know is basically the technology where the innovation is or research and development is a constant process. That technology will never vanish. So for me, I'm a staunch follower for this examer laser. Having spent 20 years of career in exclusive refractive surgery, I can vouch for this system. So what I know is this is the most refined technique till now. Various options are available. We know we have options to treat myopia, hyperopia, presbyopic treatment. There are many multiple options. It has customization is possible in these cases. As we know, most of the platforms are providing customized treatment. Therapeutic advantage like PTK. So, and this platform has to be user-friendly. So I'm going to introduce you new Micron M7 examer laser system marketed by Appasamy Associates. So the peculiarity of, in short, I'm going to brief you about the new system. Basically is the smallest footprint possible. So even a 150 square foot area is more than enough to run that user-friendly machine. So everything you can operate environmental friendly. You don't require any temperature or humidity quotient for this. You don't require any continuous air conditioning system and a closed optic pathway, which helps you to maintain the equipment very easily. Now, when we talk about the features of this platform is a dynamic matrix pulse setting. When we talk about this particular dynamics matrix setting means basically you cover the resolution of 0.02 mm. Whichever examer platform we are using, normally we are using a Gaussian beam. And the most important thing in any Gaussian beam, any ablation is the thermal effect created on the periphery. So when you are having a dynamic matrix pulse and when you have a Gaussian beam with a fractional ablation profile means you are offering a treatment on an entire optic zone simultaneously and randomized blind spot. So that will actually have a homogeneous post-ablation effect. So the post-ablation map will be very good. So quality of vision will be good. Another 800 Hertz lasers repetition rate. So the normal time taken is 1.5 second per dioptric correction. Again, depending upon the optic zone you choose. The reason I said customization is you can choose an optical zone and you can use a variable of transition zone while offering a treatment. Close-up surgery is basically, it has a robotic applicator, laser applicator which comes in. So when you actually, when the applicator comes, the space between the applicator and the eye becomes less. So it is actually helping you to draw a patient's attention during the laser docking. Robotic laser applicator, as I said, it's without moving a patient. You are not moving a patient, but the laser or a microscope, it moves towards patient's eye. And that creates a lot of comfort for that patient. Long static gas life. In COVID period, we all experience, we have examer laser system. And every machine comes with a gas life of 24 hours, 48 hours. Sometimes they say change it after a week. Whether you use or you don't use, you have to change the glass. This basic machine has a very good gas life. Means once refill is done, you can use the machine without another refill for almost 1.5 months. Modular design, again, it becomes, I won't be surprised if tomorrow we can use this machine in a mobile platform and we can offer a treatment. We can take away this machine and we can use it as a mobile laser platform. So this is in short what we mean when we talk about the dynamic matrix. Randomized flying spot, as I said, every spot should coincide. So this will create a less thermal effect whenever you are treating, whenever you are offering the treatment. Robotic laser arm, as I said, this laser arm as well as microscope, you can see in the thing, it will reach towards the eye, and once the treatment is docked, so then the laser will be fired from a very short distance. So effective plume is there. There is no need. So there are no environmental conditions which are offering any deviation in the laser system. We can overview, if we look at an indication standard we are already using, this machine has plus as well as combined laser thing and minus ablating system. So you can choose whatever formula you want to use. You can offer aspheric treatment because it take into consideration the Q value and anticipated the post-op Q value you will get it in this. Presbyopia treatment, this is mostly my topic of interest since I'm doing a lot of work on presbyopia. The best thing I liked about this system is you have a variable option. You can choose. So it becomes easy when you choose. You can either choose center for near or you can use center for distance. So basically whatever may be the refraction, myopia, presbyopia, hyperopia, presbyopia, or even emmetropia, presbyopia, you can actually choose. Second most important thing here is you can choose the pupil size whatever you want. Normally I do recommend to choose the pupil size up to 3.5 not beyond, but normally whichever machines are offering this presbyopia treatment, what we see is the pupil size ranges between 2.1 to 3 mm, 2.9 mm. Beyond or below that, they usually discourage us to go for presbyopia treatment. This is the advantage with this machine where you can actually customize the pupil size and offer the treatment accordingly. Topo-guided treatment, presently this platform supports TMS system, but very soon it will get compiled, means you can actually integrate this platform with any of the topography machine and you can have topo-guided therapeutic treatment for this. Surgeon-specific nomograms, I always suggest in my practice, whatever the company says, but you should adjust to your surgeon profile, whatever nomograms, so all the system, whichever system you have it, you should actually customize the nomograms as per the need because the surgeon time, the exposure time, stromal exposure time, LASIK actually how much time it takes to create a flap and do the ablation, and depending upon the surgeon should modify the nomograms as per the results. The beauty of this platform is it actually offers you a statistical analysis to determine nomogram setting. So basically after doing certain number of cases, you can adjust to your nomograms and you can define in percentile what amount of treatment you want to offer, whether it's a myopia or hyperopia or presbyopic treatment. So as I said, this is the screen which shows where you can modify center for near or center for distance accordingly. These are the pre-op and topography and post-op topography in myopia as we see. Same is when you choose the center for near. Normally what we do is in non-dominant eye we choose center for near and dominant eye we choose center for distance. So whenever I am doing a presbyopia management, I do a bilateral treatment. My experience with this platform, I'm using this for more than 18 months now. I have done, forget about myopia and hyperopia. Yeah, sorry.
Time is up.
Yeah.
As early as
So last slide. So my choice of treatment includes trans-PRK and presbyopic treatment. All my nomograms are personalized. So in all, very stable platform, robotic applicator close to patient's eye, open nomograms, innovative presbyopia management, less maintenance where the customization is possible, and a very cost-effective platform to use. Thank you very much.
Excellent, very nice talk in such a short time. Excellence is really excellent. Thanks, Ambarish.